Now, is that when the new Medicare plan will start also for 2014 that you're applying for in this open enrollment period?
Correct.
Is that also January 1st?
Normally, yes, especially if you're changing a Medicare Advantage plan or a Medicare prescription plan, it would almost definitively be January 1st.
Okay, okay.
Medicare runs on a calendar year, so their deductibles, their plans, and everything else run from January to December. So sometimes I'll have a member that just turned 65 in July and thinks they're joining a plan from July to July. It doesn't work like that. They're actually joining a plan from July through December, and then come January, it could be a new benefit.
Okay. Robert in Bluebell asks, I get so much stuff in the mail, and I'm not sure what to keep and what to get rid of. How can I tell if it's really from Medicare or not?
Well, that's another great question, because some of this stuff is so misleading. And this time of year, seniors are telling me that their mailboxes get inundated with information. They don't know what's what. So a lot of times they just throw it in the trash and they throw up their hands and say they're staying with what they have.
Right.
It's very counterproductive because they have so many choices. There are some really good plans that are available to them. If it doesn't have Medicare's logo on it, okay, it's not from Medicare. And we get a lot of people that get confused because there's these postcards that come out that look like they're very official, and they'll say 2014 Medicare update. Fill out this card and Medicare will deliver your free information. That's only a informational card. You're giving them ability to access you. It's illegal for me to cold call you, Jackie, if you're on Medicare, to knock on your door, or contact you in any way other than by mail. Even email is not legal. So it's illegal for me to do that unless you tell me it's okay. So if you fill out that card and send it back to me, now you've given me the authority to knock on your door, give you a call, send you an email, whatever the case might be, and inundate you with information. But if you look real small, they must, by law, have on there not affiliated with any government agency if they're not. And again, look for that Medicare logo because that's where it should be.
Okay. In the supplemental insurance plans, are the prescriptions separate from the actual supplement, which I believe is what, for doctors and hospitals?
Correct. Your supplement is for the doctors and hospitals. There is no prescription coverage in any of the modernized Medicare supplement plans. So someone would have to pick up a standalone prescription plan unless they had other credible coverage, which might be veterans coverage, TRICARE, pharmacy assistance of some sort, or PACE program.
Okay. What is PACE, by the way, Dan?
PACE is a state-run program. It's for lower-income seniors in Pennsylvania. You have to be 65 plus. It is funded by the Pennsylvania Lottery. So I've been doing my part to try to get everybody as much coverage as possible. And what that is, gives them very low-cost medications, especially for brand name coverage. There's no donut hole. It's really a valuable program. And if you can apply, the worst they can say is no. So I suggest most people give a call or go to your local pharmacy and ask them for a PACE application. It takes 5 minutes to fill out, and it could save someone thousands of dollars.
I'm going to ask you to explain the donut hole again, because my father brought the donut hole up to me, and he said, don't you know what that is? And of course, I had no clue what the donut hole was.
Okay.
Now, you said it's going to kind of go away by
2020. Correct.
But what is it today?
Well, the way the donut hole works, originally when Medicare came out with its prescription plan coverage in 2006, it gave you about $2,500 worth of medication, retail medication. And then you hit the donut hole or the coverage gap. What's in the middle of a donut? Nothing.
Nothing.
What's in the middle of this coverage? Nothing. So Medicare beneficiaries were paying 100% of all costs after they hit their limit. In 2014 coming up, they will have $2,850 worth of medications to be able to get. And then once they hit that gap or the hole, it's kind of half filled in now. So for brand name medications, a Medicare beneficiary only has to pay 47%, and for generic medications, they would pay 79%. And by 2020, those percentages will get smaller and smaller, so it's the flat, same coverage all the way throughout the entire year.
Right. That's very interesting, because donut hole, I think of the donut, but then I think of the middle as nothing.
Right.
So it really doesn't have anything to do with when you were born My father thought it had something
No,
to do with that. Isn't that
absolutely nothing to do
interesting?
with what you're born.
Yeah.
Strictly on your prescription usage, that's all. And those numbers start over every year, every January. So again, very important to make sure you're looking at a plan that's going to fit your needs for your particular medications.
So when you hit that maximum, whatever it may be,
Mm-hmm.
2,850, 2,500, you know that you're going to pay more
Correct.
for
Your
your
cost is
prescription.
essentially going to rise
gonna go up.
during that period. And when we review your coverage, so if you did come to someone like myself where you go to Medicare.gov, they can project for you whether or not you're going to go into that hole or not, and how long you're in it, and do you come out of it, because there is an ending to the hole where your cost goes way down. But again, that would be something that someone could show you. In July, you start hitting the hole. By September, you're coming out and your cost is going back down.
Okay. So what about the changes in Medicare every year? Because there are a lot of them. I've heard that the plans change. They don't change during the year. They change during this open enrollment or for
Correct.
this open enrollment period. Is that
Correct.
how it works?
So Medicare Advantage plans, a lot of times people will not review their coverage each year because they were so happy with their benefit for the prior year.
Right.
Not aware that their plan could be drastically changing. So these companies have the right to change or cancel benefits at the end of each year. So from January through December, your coverage is good. But come January 1 of the following year, your benefits could be completely different. So, for example, say you have a Medicare Advantage plan that is now $200 a day in the hospital. Come next year, it could be $500 a day. That plan has been authorized by Medicare. Everything is good to go. And they make you aware of it, but we're getting inundated with all that other information coming in at that time of year. Too often it just gets thrown away with everything else, and no one really investigates the way their plan is changing. A medication you were taking may have gone generic during the year, and for the following year the plan doesn't want to cover the brand name anymore, but your doctor says you need to be brand specific. So again, that's something that you need to make sure is being taken care of for you for the following year.
Okay, so and you can do that. So that's something that
Absolutely.
you can control a little bit.
Again, review that coverage each year to make sure that you're always in the best spot that you can be for the upcoming year. I should also say there's no benefit in overbuying coverage. Okay, so there's some plans that will give you coverage in that donut hole for your medications, but those plans will range over $100 a month in a lot of cases. And unless you're utilizing every dollar of that benefit in the donut hole, it's probably not worth your paying over it, because you can join that plan if it is the best plan for you the next year and come October. And there's no guarantees that that plan that's covering it this way in the donut hole this year will be there next year.
Will be there next
So again, you need to review that every year. Very, very, very important.
It's a lot of companies, a lot of plans. Now, are all those plans offered by those companies the same? Because
For Medicare supplements, they're the same.
Are
So
they?
if they have a letter after it, a Plan C, a Plan F, a Plan
G.
whatever,
Right.
G, okay? Those plans are exactly alike from every carrier. However, Medicare Advantage plans and prescription plans will be different from each carrier.
Gotcha.
Okay, so that's why you need to explore those benefits. One Medicare Advantage plan may have a $500 per day benefit in the hospital. Another one may say it's $800 per stay. So it's very important to understand what is being offered to you and the way your plan is changing.
It sounds to me like you do need to sit down and talk to somebody, whether it's someone like yourself who is an expert in Medicare or Medicare.gov,
Absolutely.
where you can actually get information that you know is right on
Without
the
a
money.
doubt, you want to be able to compare. The downside to just being Medicare.gov, and they will give you the correct information, they're not familiar with your community, your doctors, the layout of the
Okay,
land, if
all
you
right.
will. So dealing with a professional in your area, we probably use the same doctors, or we've gone to the same hospital, or we've been around. We know the networks pretty well. We know a lot of the specialists in the area. We have a little more feel for the drugstores that are in the area, what's being built nearby, what's not. So Medicare will run it with the exact information that they ask you, the minimum information. A community professional that's in your area knows the lay of the land and knows the questions to ask you to really fine-tune what your benefits will be.
What would you say is the most important thing when you're looking at Medicare or a supplement?
Really, you're buying insurance because you want to be protected. So some people are very risk friendly. They don't mind paying out a little more out of pocket. Other people just want a flat premium, and that's all they're going to pay all year long. They feel very comfortable in that way. So the most important thing is do what makes you feel comfortable. Don't do what your neighbors did. Don't do what your cousins did. Do what makes you feel comfortable. Don't do what the person across the table is telling you is all you can do. Explore the options. When you put your head on the pillow at night, you need to make sure you feel best about where you're going with your coverage and what makes you feel most secure.
Right. Okay, so that's the most important thing, you think?
Absolutely. Make sure you're exploring what is the benefits that you want out of your coverage. Because, like I said, there's so many choices. There's a plan that will fit everybody without a doubt.
So let's describe the procedure from start to finish. It came October 1st, and now we need to look at everything. So we sit down with somebody, we look at all the supplements, and we look at Medicare and what the changes were to Medicare
Right.
For the coming year. And then
What would basically happen, depending on what you're doing, if you were doing a Medicare Advantage plan, it's simply filling out an enrollment form, and the enrollment form will be submitted to Medicare. Medicare will approve it as long as everything's in order, you live in the county that it's in, and you're qualified for it. And then those benefits would start January 1st.
okay.
Let's say you're changing from Medicare Advantage to a Medicare supplement. Well, then we need to enroll you in a standalone prescription plan and also get your coverage started with an underwritten. So there wouldn't be a physical or no one coming out and taking your blood and weight and all that kind of stuff. But there would be a bunch of medical questions that are asked and what medications you're on. And there'd be a health history, that a telephone interview type of thing that could occur. Once all that is done and you're approved, you'd be ready to go for January 1st. Your coverage, you could then cancel your other coverage. Never cancel your other coverage until you know you're enrolled in the new coverage. Okay?
Right, yeah. I remember somebody calling me and talking to me when I first signed up for my supplement. So it was kind of interesting. Listen, it was very nice of you to come in today and answer the
I'm
questions.
glad I could be here.
And I'm sure if people have additional questions, they can come back to you and ask more.
Absolutely.
And so thank you very much for being
Thank
part
you for
of
having me,
Your
Jackie.
Senior
Appreciate it.
Advantage. Thank you for coming to Your Senior Advantage. And I'd like to thank Dan Young from Young Insurance Services for all of the expertise on his Medicare segment that he did today. We hope that you'll join us again. Thanks for coming.